21 healthy living tips for people who have diabetes. Making healthier food choices is very important in managing and reducing the risk of diabetes complications. We know that not everyone agrees on what is the best diet. Working closely with your doctor, you can manage diabetes by focusing on essential aspects. In this video, we are going to show you as many as 21 healthy living tips for people living with diabetes that will give you insights on diet, exercise, medications, prevention of risky situations, and more. But before we begin, be sure to subscribe to our channel for more of our amazing content. Please give us a like, share the video, and don't forget to turn on the notification bell for timely updates of our latest uploads. Please do keep in mind this is an educational video on medical issues. We're not doctors, and every change in your lifestyle, you should consult with your medical doctor. Let's get it on. Number 21. Meet healthy eating rules. Healthy eating is a cornerstone of healthy living, with or without diabetes, but if you have diabetes, you need to know how food affects your blood sugar levels. It's not only the type of food you eat, but also how much you eat and the combinations of food types you eat. This is crucial when you have diabetes, because what you eat affects your blood sugar. No foods are strictly off limits. Focus on eating only as much as your body needs. Get plenty of vegetables, fruits, and whole grains. Choose non-fat dairy and lean meats. Limit foods that are high in sugar and fat. Remember that carbohydrates turn into sugar, so watch your carb intake. Try to keep it about the same from meal to meal. This is even more important if you take insulin or drugs to control your blood sugars. Number 20. Use carbohydrate counting. The key to many diabetes management plans is learning how to count carbohydrates. Carbohydrates often have the bigger impact on your blood sugar levels. For people taking mealtime insulin, it's important to know the amount of carbohydrates in your food to get the proper insulin dose. Learn what portion size is appropriate for each food type. Simplify your meal planning by writing down portions for foods you eat often. Use measuring cups or a scale to ensure proper portion size and an accurate carbohydrate count. You can also use apps like MyFitnessPal that help you monitor carbs intake and diet. Number 19. Make every meal well balanced. As much as possible, plan for every meal to have a good mix of starches, fruits and vegetables, proteins and fats. Pay attention to the types of carbohydrates you choose. Some carbohydrates such as fruits, vegetables and whole grains are better for you than others. These foods are low in carbohydrates and have fiber that help you keep your blood sugar levels more stable. You should also get familiar with glycemic index and insulin index of food. Ask your doctor, nurse, or dietitian about what ranges of those indicators are right for you. And next, you can find plenty of books, lists, and infographics with food grades by the index, what will help you choose to compose right meals. Number 18. Coordinate your meals with medications. Too little food in proportions to your diabetes medications, especially insulin, may result in dangerously low blood sugar, also called hypoglycemia. Too much food may cause your blood sugar levels to climb too high, a condition known as hyperglycemia. You should ask the doctor about how to coordinate meal and medication schedules. Number 17. Avoid sugar-sweetened beverages. Sugar-sweetened beverages tend to be high in calories and offer little nutrition. And because they cause blood sugar to rise quickly, it's best to avoid these type of drinks if you have diabetes. The exception is if you're facing a low blood sugar level. Sugar-sweetened beverages such as sodas, juice, and sports drinks can be used as an effective treatment for raising the blood sugar level quickly that is too low. Number 16. Start to exercise. If you're not active now, it's time to start. You don't have to join a gym and do cross-training. Just walk, ride a bike, or play active video games. Your goal should be 30 minutes of activity that make you sweat and breathe a little harder most days of the week. An active lifestyle helps you control your diabetes by bringing down your blood sugar. It also lowers your chances of getting heart disease. Plus, it can help you lose extra pounds and ease stress. When you exercise, your muscles use sugar for energy. Regular physical activity also helps your body use insulin more efficiently. These factors work together to lower your blood sugar level. The more strenuous your workout, the longer the effects last. But even light activities, such as housework, gardening, or being on your feet for extended periods, can improve your blood sugar. Number 15. Don't rely on ready training plans. You should start with choosing the type of exercise that's appropriate for you. Rather than basing on training plans from the internet, is good to have a professional support from a personal trainer who's experienced in leading diabetic clients. If you've been inactive for a long time, your trainer may want to check your overall health before advising you, and will recommend the right balance of aerobic and muscle strengthening exercise. Number 14. Fit exercise routine into a daily schedule. When you get training plans, it's always good to talk to your doctor about the best time of day for your exercise. Doctor's role here is to coordinate your workout routine with your meals and medication schedules. Number 13. Check your blood sugar level. Check your blood sugar level before, during, and after exercise, especially if you take insulin or medications that lower blood sugar. Exercise can lower your blood sugar levels even up to a day later, especially if the activity is new for you or if you're exercising at a more intense level. Be aware of low blood sugar warning signs such as feeling shaky, weak, tired, hungry, lightheaded, irritable, anxious, or confused. If you use insulin and your blood sugar level is below 90 milligrams per deciliter or 5.0 millimoles per liter, have a small snack before you start exercising to prevent a low blood sugar level. Number 12. Stay hydrated. Drink plenty of water or other fluids while exercising because dehydration can negatively affect blood sugar levels. Number 11. Always be prepared. Always have a small snack or glucose tablet with you during exercise in case your blood sugar level drops too low. Also, wear a medical identification bracelet. Number 10. Adjust your diabetes treatment plan. If you take insulin, you may need to reduce your insulin dose before exercising and monitor your blood sugar closely for several hours after intense activity, as sometimes delayed hypoglycemia can occur. Your doctor can advise you on appropriate changes in your medication. You may also need to adjust treatment if you're increased your exercise routine. Number 9. Use medications properly. Insulin and other diabetes medications are designed to lower blood sugar levels when diet and exercise alone aren't sufficient for managing diabetes, but the effectiveness of these medications depends on the timing and size of the dose. Medications you take for conditions other than diabetes can affect your blood sugar levels. Number 8. Store insulin properly. Insulin is especially sensitive to extremes in temperature, so don't expose it to the sun or extremely low temperatures. Insulin that's improperly stored or past its expiration date may not be effective and risky for health. Number 7. Report the problems to your doctor. If your diabetes medication causes your blood sugar level to drop too low, or if it's inconsistently too high, the dosage or timing may need to be adjusted. Number 6. Be cautious with new medication. If you're considering an over-the-counter medication or your doctor prescribes a new drug to treat another condition, such as high blood pressure or high cholesterol, ask your doctor or pharmacist if the medication may affect your blood sugar levels. Sometimes an alternate medication may be recommended. Always check with your doctor before taking any new over-the-counter medication to know how it may impact your blood sugar level. Number 5. Be prepared in case of illness. When you're sick, your body produces stress-related hormones that help your body fight the illness, but they may also raise your blood sugar level. Changes in your appetite and normal activity also may complicate diabetes management. Number 4. Plan ahead. Work with your healthcare team to create a sick day plan. Include instructions on what medication to take, how often to measure your blood sugar and urine ketone levels, how to adjust your medication doses, and when to call your doctor. Number 3. Continue taking diabetes medication. However, if you're unable to eat because of nausea or vomiting, contact your doctor. In these situations, you may need to adjust your insulin dose or temporarily reduce or withhold short-acting insulin or diabetes medication because of a risk of hypoglycemia. However, do not stop your long-acting insulin. During times of illness, it's important to monitor your blood sugars frequently, and your doctor may instruct you also to check your urine for the presence of ketones. Number 2. Stick to your diabetes meal plan. If you can, eating as usual will help you control your blood sugar levels. Keep a supply of foods that are easy on your stomach, such as gelatin, crackers, soups, and applesauce. Drink lots of water or other fluids that don't add calories, such as tea or herbs, to make sure you stay hydrated. If you're taking insulin, you may need to sip sugar-sweetened beverages, such as juice or a sports drink, to keep your blood sugar level from dropping too low. Number 1. Manage stress. Stress causes people to become ill. And when you have diabetes, stress can significantly affect your ability to control the condition. If you're under intense stress, you can easily skip meals or forget to take your medication, which ultimately can affect your blood sugar level. Although you can't completely remove stress from your life, there are several ways you can reduce it. And by learning to better manage stress, you can help keep your diabetes under control. Plus, with less stress, you'll have the energy you need to eat right, exercise, and check your blood sugar. That's all in our video about healthy living tips for people who have diabetes. Remember, before taking any action you've learned, please consult with your doctor. We are not medical experts. This is simply a medical educational video. If you found it useful, be sure to subscribe to our channel for more of such informative content. Give us a like, share the video, and don't forget to turn on the notification bell for timely updates of our latest uploads. We value your feedback. Feel free to share your thoughts with us in the comment section below. Remember to watch other related videos listed in the video description below.